Welcome back. Right now we have with us Michael Brand-Zawadzki. He is the Executive Medical Director of Hoag Neurosciences Institute and the Ron and Sandy Simon Endowed Chair. Nice to have you here today.
Well, thank you, and most recently the Senior Physician Executive at Hoag.
Very good, very good. Well, we are going to primarily talk about how you're expanding this world-class care to the Hoag Health Center right over here in Irvine, which is wonderful. But overall, discuss the need of the neural services in this community and really the whole area. And it's great to see how it's expanding.
Well, thank you. As you mentioned, Hoag has just opened the Health Village, as we're referring to it, on Sand Canyon. And the facility allows us to extend our specialized services model, which is transforming healthcare delivery. That model utilizes programs. Think of them as small businesses, each focused on a specific special patient condition. So the Neurosciences Institute is a holding company, if you will, for these programs that deal with patients who have memory and cognitive problems, back pain and spinal issues, epilepsy, stroke, brain tumors. Each of those conditions has a multidisciplinary team, physician-led, that focuses on that condition, and we will have an outpost for our programs, our specialized services in our Irvine Health Village here on Sand Canyon.
Oh, wonderful. And to see that expand is just expand over the years, the study of this, and I think is wonderful because as you just mentioned, you went through a litany of different things that covers that people may not always realize that the neurosciences cover, but it's really amazing. I mean, obviously the study of things like dementia and Alzheimer's, just that alone, the amount of effort and studies that have done in that is tremendous, and obviously a lot more to follow.
Well, that's a great example. So the demographics of Orange County show that the fastest growing population component is folks over 65. 10,000 Americans turned 65 this morning as we're having this interview.
Yeah.
And 1 out of 8 will have mild cognitive impairment, the first steps towards what could become dementia of Alzheimer's disease or some other sorts. 1 out of 4 actually have memory issues, and half of those memory issues are completely treatable if diagnosed early. So our Orange County Vital Brain Aging program, you can find it at ocbrain.org, addresses those issues with community education, physician education, and tactics to provide early assessment and then management of memory problems in our senior population. It costs Medicare 3 times as much to have to deal with a patient who has a memory condition as it does folks who don't have that problem, because those folks forget to take their medication, they forget to follow doctor's orders, et cetera. So the Memory and Cognitive Program is a great example of a large need, particularly in the senior community, that needs to be addressed through a multidisciplinary team of experts that can address the issue. Same thing with back pain and spinal issues. We will have in our Health Village our program lead, Dr. Osger, who runs our back pain and spine program to address back pain issues and spinal issues. Most of those do not need surgery. When they do, minimally invasive techniques can be provided. And so that'll be another example of a patient-focused condition, one of our programs, that's delivered to our community. And you know, seniors in particular need specialized services. They don't think of vaccinations and annual physicals. They worry more about their diabetes, their back pain, their heart condition, their memory and cognitive disorder. So they look for expert, trusted specialists, and that's what we are extending to our Irvine community now through our Health Village on Sand Canyon.
And it's like the opposite end of the spectrum, the specialists for pediatrics and the specialists as you age as well.
That's exactly right. And so pediatrics is there's a lot of preventive care in pediatrics, so primary pediatricians are critical. But as we age, specialists become much more important.
Let me ask you a question. As you know, that when it comes to memory impairment as you get older, we have specialized sort of a preventative care for colon cancer and colonoscopy, all kinds of different things that you can go in on an annual or every few years basis. Is there something developed where people can go in starting at age, with colon cancer, for example, you go in, or mammograms, you start at 40 or whatever it is, where adults can start going in maybe every 5 to 10 years, where they can check out your memory? Is there something like that available yet where, as we have for other things, that you can prevent things down the road?
I forgot. No, I'm just kidding. Oh, yes, I'm glad you asked the question.
Very good.
I'm glad you asked the question. In fact, exactly right, there is. So the whole point of Orange County Vital Brain Aging Program is to provide early assessments once the community and the physicians are educated. It turns out that Medicare today will reimburse physicians for assessing cognition once a year, just like for a regular physical.
Very good.
Vast majority of primary care physicians do not provide that assessment to their patients in their offices. So we've taken the step of actually facilitating that and provide an assessment service that can be accessed through ocbrain.org, our Orange County Vital Brain Aging Program. And we provide that assessment in senior centers, as we are providing it in our facility in Sand Canyon. In Laguna Woods, there are times when we provide that. So if folks are interested in assessing, and they should be once a year, assessing their memory and cognition, it's a simple half-hour, very cheap test, $45, and it can detect memory conditions at a very early stage, which can be addressed. People are afraid to take the test. Oh, what if I find out I have something wrong? Nothing can be done. That is not true.
Okay.
Yes, things can be done, and the earlier, the better. Both behavioral management and certain pharmaceuticals, depending on the condition. Once the test is abnormal, then we figure out what the condition is. And the other point is, if you're worried about it, 3 out of 4 folks test normal. So just the reassurance of being one of the 3 out of 4 that are normal is well worth the once-a-year test.
Yeah, and I think our down the road, the senior center does this a couple times a year. The Sylvester Senior Center.
And it's through our team that that's done.
And they have, when they've come on and talked about it, they just say how great it is.
Now it will be available at Sand Canyon as well.
Fantastic. Describe the level of subspecialized care needed for neuro issues.
Well, so the most common conditions that we see in the aging population are, again, memory and cognitive disorders, one of the biggest fears. Again, 1 out of 4 folks over 65 will have a memory issue. Part of those include having medication problems. So a good example is pain medication. So in fact, we're surprised to see how many seniors become dependent, even addicted to pain medication. And so we also provide, under the umbrella of the Neurosciences Institute, an addiction program that helps people wean off of unnecessary pain medication like opiate medication. Back pain, we talked about, is a concern for seniors. And unfortunately, our senior population also has a propensity for developing cancer. So brain tumor treatment, we have one of the busiest brain tumor treatment programs in the country. Movement disorders and Parkinson's disease. We have a program built around movement disorders and Parkinson's. We have a neurosurgery, neurology, social services, physical therapy team dealing specifically with Parkinson's and movement disorders. We will have a physical rehab facility for folks with Parkinson's on Sand Canyon. So Parkinson's is also the second most common neurodegenerative disorder in the seniors. So often goes undetected in its early stages. The sooner, the better. Specialized neurologists are needed to detect it. I've seen orthopedists mistake Parkinson's for shoulder issues or stiffness from musculoskeletal disorders and treat patients who actually have Parkinson's for several years for conditions that aren't the right
Yeah.
diagnosis. So having a specialized team, folks like neurologists who understand those conditions, critical.
Well, Doctor, I thank you for coming by today. It's great to see the expansion of the Irvine area.
Yes.
It's wonderful. It really is.
In my
Yeah.
bigger hat overseeing specialized services, we also have a cancer institute outpost in Sand Canyon. We also have our women's services there, our gastroenterology services. So a number of specialized services will be housed in our new healthcare village.
All right. Thank you very much. The website is hoag.org/neurosciences. Of course, you can just go hoag.org to find out about other things. Number over there is 949-764-6066. Thank you so much for coming.
My pleasure.
on.
Thank you for having me.
Always a pleasure. We'll be right
Likewise.
back.